So unfortunately, IAM President Victor Zhao had to leave a little bit early, but he conveyed to me his thanks for all of you to come here. I think both Peter Sands, the chair of the commission, and Victor were very happy with the kind of discussion and deliberations we've had. We haven't found answers, but we've certainly expanded the set of options which the commission can now consider. With a thanks to all of you, also want to ensure we thank the AV team here and our scribe who've been very patiently taking notes of our meeting while our volumes have gone up and down and they've been adjusting. So thank you to them. And thank you again to the IOM staff who've helped put together this workshop and the planning committee, which was involved in spending time to create the sessions and the workshop. With that, I want to hand over to Ceci, who's going to describe to us what the next steps are and when should we expect a report out on this and what kind of products will come out. Ceci, please.
Good afternoon. Thank you. I am Ceci Mundaka Shah, and I'm the site director for the Commission on a Global Health Risk Framework for the Future. And I just want to, on behalf of the Commission, thank all of you for participating in this workshop. And I just want to spend a few minutes explaining and presenting this slide once again. Dr. Zhao presented it early when we started the first day of the workshop. And I just want to note that this workshop of pandemic finances serves a dual purpose. So the first one is to gather all the perspectives as they have been introduced by workshop moderators and speakers and attendees. So this will be summarized in a report, a workshop summary that will be published by the Institute of Medicine and the National Academies Press in early next year. And I just want to know that this will not be a comprehensive review of the topic area covered, but it will just, again, be a summary of all the perspectives raised by the participants in this workshop. And the second purpose of this is, as you can see on the slides, is to serve as one of the pillars of evidence that will guide and inform the Commission in their efforts to develop a high-level report. So as you can see in the timeline, we've already, 3 of the workshops have already taken place. We have our next workshop, as you just heard a few minutes ago, next week in London. And we have 2 more commission meetings that will take place in early October and November. This is indeed a fast-paced timeline, but will allow us to have the report completed and released to the public early in December. And this will hopefully be in time for the World Health Assembly Executive Board meeting. So I will just want to say that, of course, 2 days are not enough time to discuss all the relevant issues related to this topic. So I would just like to ask you, if you want to share any information or any additional resources with the Commission, to please communicate with us using the contact information on the screen. If you have any questions to us, the same way you can communicate with us through this email. Thank you.